And Jessi joins us now from Washington. This is eye-opening because many of us think of the healthcare industry as booming right now. What exactly would those in healthcare, including the doctor you spoke with, like to see Congress do to help their industry out?
Yeah, I mean, you're right. When everybody's watching on the news, really what you're seeing is the hospitals that are impacted the most, the ICUs and the emergency rooms, trying to deal with that influx of patients that likely have the coronavirus, and then they're starting to treat them on ventilators and everything else. And so, yeah, a lot of people don't even realize that other doctors, nurses whose livelihoods depend on these elective surgeries have really not even been going into the office. And these elective surgeries can be anything from a colonoscopy to a hip replacement to dental surgeries. So people all across the healthcare spectrum are really having to put this off. And in turn, all of those doctors and nurses and even those who, work the desks and things of that nature are not able to work. And so, yeah, Congress, that doctor I talked to, Phil Rowe, Congressman Rowe, who he was saying that essentially Congress could just kind of tweak some things in the legislation that's already been passed, like we've seen lawmakers do with other aspects that have been hit by coronavirus, and essentially just say, the hospitals, there's funding for them. Why don't we help out these other medical professionals as well? And so what they've been seeing, and, it's kind of typical of things where you just kind of have to go day by day, but some groups, some people can fall through the cracks, and then you kind of have to make up from it from there. So that's what they're hoping ultimately, is that potentially these people, these medical professionals, could get some money as well.
And once elective surgeries are given the green light again, do doctors expect to bring those furloughed workers back?
They're hoping so. Just with everything that we've seen, everything is kind of this sunrise approach, I think, is what a lot in the healthcare industry are saying. It's not a light switch, flipping a switch, it's a sunrise. They will potentially be bringing all of them back. That's the purpose of them being put on furlough, but it won't happen all at once, since some states, even today, I think it was Colorado, Iowa, Indiana, just to name a handful there, they did start elective surgeries again today, but it's not like there could be a line out the door or anything of that nature. And then there still are probably people still very skeptical of going in and getting a procedure done. And so it'll probably just be a phased-in approach, just like we've been seeing with everything else. So a lot of coworkers may not be back to working together still for some time.
And that was Jessi Turnure tonight in Washington. Kentucky